unfortunately, perfect. The mission of the Arts Commission is to provide equitable access to the arts to all individuals across the state. However, we know, unfortunately, that often art spaces and programs are not always welcoming to individuals with disabilities. And often there are barriers that exist within the arts that prevent individuals with disabilities from participating in them. So, in pursuing our mission of equitable access to the arts for all, we feel committed to helping arts organizations as well as individuals increase their understanding of how to make their programs and spaces accessible to individuals with disabilities. The Arts Commission has developed an incredible partnership with the amazing team at Able South Carolina, who is assisting us with our accessibility work across the agency. We've worked with them to develop this webinar series for you all. Each month, one of their expert staff members will lead the webinar to provide information on various topics of accessibility. We are thrilled that you've decided to attend and hope that you find the information valuable. This is the first of a 6-part series. Going forward, it will be the first Wednesday of the month through July of this year. So please consider registering for the rest of the sessions. For today's session, we'll be focusing on disability culture and awareness, and our presenter is the wonderful, charismatic, and knowledgeable Dori Tempio. She is the Senior Director of Community Education at Able South Carolina, and we're so excited that she's here today. So Dori, please take it away whenever you're ready.
Good afternoon. How is everybody? We are so excited to have you all here. I am actually doing this training with a colleague of mine, Carrie Driggers, who is our community training coordinator and trains this information alongside me. And we are so excited to be with you this afternoon. I'm going to have Carrie put up the PowerPoint and we will get started. So welcome everyone. We're so thrilled to have you here. David, did you have anything you needed to add before we get started?
I appreciate it, Dori. Yes, just some opening thoughts. I think most of us on this call, you've either heard from myself or from Mary Reeves, just my colleagues. Oh, by the way, my apologies. I am David Laird. I serve as the Director of Strategic Initiatives. I am a white man with a bald head and a very bearded face. It's just in my mid-40s. We are so excited to have this conversation, and we've extended this partnership through the Arts Commission, really exploring ways that we can enhance accessibility through arts organizations from an accessibility viewpoint, from a programmatic viewpoint, and also just from a knowledge area. We are thrilled for these services, and we look forward to working with each of you soon. What will likely happen following after, as soon as we're complete with this webinar, is we're going to send some follow-up information regarding our evaluation. We love your feedback, but also we're going to share with you some additional services that we may be able to offer that just thanks to the support and the guidance from the Arts Commission. So please be on the lookout. That will either come from myself or from another one of our staff members. And also what we try to share with everyone is that we really want to be your disability partners. We do not see this as a singular, one-time only conversation. If you have any questions regarding disability services, disability programs, please reach out to us at any time, and we are happy to provide that type of resource. As I'm sure that Dori will share, the knowledge we share is not only comes from knowledge expertise, it's from our shared life experiences. As the state's largest and oldest center for independent living, and with 85% of our staff having individuals with disabilities, these are situations that we live with on a daily basis. So we are happy to share this information. Thank you again to the South Carolina Arts Commission. And Dori, I believe I'll turn it over to you.
Wonderful. Thank you, David. Welcome everybody to our first webinar on rethinking disability, disability culture, awareness, and the arts. Today is January 10th, 2024, and we are so glad to be with you this afternoon. So we're going to go to the first slide. Hello, I already introduced myself, but I'll make sure everyone knows who I am. I am Dori Tempio. My pronouns are she, her, and hers. I am the Senior Director of Community Education for Able South Carolina. I've been here with the organization for 12 years. I am a person with lived experience of disability. I have both a developmental disability and a physical disability. And I also have credentials being an ADA coordinator. I am also an ADA National Network trainer, and I have a master's degree in counseling from Johns Hopkins University. So I'm so glad to be here with y'all. I also have my bachelor's in education, and I was a teacher for 12 years. So go for the educators in the room. I love teachers. I love education. We want to show you, and I'm going to demonstrate it first, an important accessibility component that we all need to be doing when we're showing visuals or giving presentations with visuals in them. You don't want to assume that everyone in your audience can see the screen. We may not know our coworkers' disabilities. We may not know our funders' disabilities, our community partners' disabilities, or our customers and patrons' disabilities. So one of the things you really want to do is describe any visual in your presentation. So I'm going to start out describing my picture. I am a white individual with blue eyes. I have dark brown hair with light brown highlights. I'm wearing a flowered dress with a white shirt underneath, and I am sitting in a black and blue and teal and silver power wheelchair outside with greenery or bushes in the background. Today I am also a white individual with blue eyes. My hair now is a dark brown with red highlights, and today I'm wearing a pink sweater dress with a dark bluish green shirt underneath with gold jewelry on. And I'm wearing my glasses today. I don't always wear them, but today I'm wearing them. I have my blue glasses on. And that is a visual description of me. I'm going to let Carrie take it away.
Good afternoon. My name is Carrie Driggers. My pronouns are they, them. I am the community training coordinator for Able South Carolina. I work in the Greenville upstate office, whereas Dori is down in our Midlands office. My background is much shorter than hers. I've been in the nonprofit realm for quite a while. I am a person with invisible disabilities. So I have a psychiatric disability, I have a suspected developmental disability, a physical disability, and also an eating disorder. So as David said earlier, we are both people with lived experience with disabilities. My picture on the screen is me in a teal shirt with blonde hair just about down to my shoulders, with glasses on, and standing in front of some greenery with a floral tattoo sleeve on my left arm. And then today I continue to be a white person with blonde hair, with glasses on, and more of a hunter green shirt today.
All right, so we're going to go to the next slide and get this started. Today, we're going to be focusing on the Americans with Disabilities Act, or the ADA. We're going to talk about understanding disability and what that looks like, some myths and misconceptions around disability, some barriers that the disability community can be impacted by when trying to access art opportunities and other community opportunities. We're going to talk about language and identity amongst the disability community. We're going to talk about unlocking barriers. We're going to talk about inclusive programming, and we're going to answer any questions you have. If you have a question before we get to the end, feel free to drop it in the chat or unmute yourselves and raise your hand. If we're going to get to it, we might just politely say we're getting there. Otherwise, we're happy happy to answer. And if you want more detail than we give, just let us know. We're happy to provide anything we possibly can to make your understanding and your enjoyment of the webinar even better. So David helped us out by briefly talking about our organization. So Able South Carolina, we are the largest recognized federal disability-led organization in South Carolina. We are working to seek transformational changes in systems, communities, and individuals. We've been around since 1994, and we continue to remain a consumer-controlled, community-based, cross-disability nonprofit. In a nutshell, we go to people with disabilities if they can't come to us, and we serve anybody with any health condition or disability, no matter the age. So our youngest consumers are babies, and our oldest is over 100, actually. We're happy to say, as David pointed out, that over 3/4 of our staff are people in all categories of disability, as are over half of our board of directors. So in a nutshell, we are the people that we serve. Every day we practice equity, disability, justice, and representation, and true inclusion through fostered consumer-driven independence and disability pride. Carrie and I often say during these presentations, we don't just live this. When we go home, our disabilities continue. When we're in the community, even at the grocery store, people will come up to us and ask us for resources, tools, and ideas for things that can help them. So we're proud to say we're members of the disability community. We're proud to live it every day. Carrie, what's our mission?
So we have a three-pronged mission. We are an organization of people with disabilities leading the charge to, one, equip people with disabilities with tools to foster pride and to direct their own lives. Two, to educate the community to challenge stereotypes and eliminate barriers. And three, advocate for access, equity, and inclusion at the individual, local, state, and national level. Our vision is a South Carolina that is a national model of equity and inclusion for all people with disabilities. And this on the screen is a picture of our staff from last year's Advocacy Day for Access and Independence. It is our staff with visible, invisible disabilities, and also some of our staff are non-disabled. So they are people in wheelchairs, they are people with service animals, all of us with our hands in the air celebrating access to independence.
Woohoo! I wanted to share with y'all some important artists who have been instrumental in not only disability inclusion and equity, but in the arts community as well. We have Alan Holdsworth. He's a singer, a songwriter, and activist. His music addresses civil rights, disability pride, and social injustices. He is a crucial voice in the disability rights and equity movement, and he is one of the most beloved performers on the disability arts circuit. In 1990 and 1992, Alan co-organized something called the Block Telethon. It was a high-profile media and community campaign that culminated in the demise of the televised fundraisers focusing on people with disabilities. And the reason behind that is telethons fostered what we call, in our community, the pity model of disability, where people viewed people with disabilities as people to feel sorry for, people that were not capable, and people that did not get the same opportunities as everyone else. So he worked through his art and through his music to eliminate that barrier for people with disabilities. Next slide. Then we have Judith Scott. Judith Scott is a famous American fiber sculptor. She died recently. She was born with Down syndrome. She was also an individual with a hearing disability. She was completely deaf. Judith was internationally renowned for her art. And so I thought it was really important that we show disability representation in this training because we're talking about making the arts accessible for people with disabilities. We're talking about making art programs inclusive of people with disabilities. And ultimately, we're talking about creating a space for artists, no matter the medium, to take part and be uplifted for the art that they do in equal terms to people who are non-disabled. And so we wanted y'all to see some examples of artists with disabilities. Next slide. I often ask this question, as does Carrie, because we hear it very rhetorically sometimes. What does it mean to have a disability? Oftentimes, people wonder that. They're like, what conditions, what medical diagnoses make up a disability? And so we have for you a collage of pictures, and all of these individuals in these black and white pictures are individuals with disabilities who live right here in South Carolina, and a lot of them participate in the arts. They have invisible disabilities, visible disabilities. They are of a variety of ages, a variety of socioeconomic backgrounds, and they have a variety of disabilities. And so I wanted y'all just to get a glimpse. These are the people who live here. These are the people who you will encounter in the work that you do. And these are people who want to take part in art programs. So let's go to the next slide. The Americans with Disabilities Act. It is what helps oversee the inclusion and equity and accessibility of people with disabilities into art programs, into art venues, and into places in our community which showcase art. So we're going to go to the next slide, Carrie. Disability, according to the Americans with Disabilities Act, it is defined as the substantial limitation in being able to perform one or more daily living activities. And what we want y'all to take away from this definition is it's not saying people with disabilities can't do everyday living activities. It's not saying people with disabilities don't do everyday activities that we all do. What it's saying is people with disabilities are afforded protections and reasonable accommodations or supports to take part in community activities like art, going to art museums, and participating in community living that everybody does. I want to see if everybody's awake on a Wednesday afternoon after yesterday's excitement around our state. Who can tell me one thing that you've done today during your day? Tell me one activity. You can either put it in the chat or you can unmute yourselves, whichever you feel most comfortable doing. Who can tell me one thing you've done today? Put the dishes away. All right, Amanda. Walked your dog. Met with the director of the Nickelodeon, Dolly. That's one of my favorite places to go. Cooked my breakfast. Went to the bank. Conversed on the phone. Woohoo! I'm seeing if any others. Gone shopping for an opening reception. Had 2 meetings with Able staff. Got dressed. Worked on a collage. I'm seeing if any more are coming up. Sent emails. Had 2 meetings. Helped someone with a challenging personal situation. Sent emails. I'm going to take a couple of those and break them down for you to kind of make this concept concrete. So I have a limitation in being able to type an email. I use what's called voice-to-text software, similar to a Siri on your phone. It's called Dragon naturally speaking. I speak into a microphone and it types out what I want to say. So I'm going to ask you all, did we both do email, regardless of whether you typed it with your hands or I used my voice to express the words in my email? What do y'all say? Yes or no?
Yes.
Woohoo! How about other people? Seeing a few yeses. Awesome. Let's give another example. So I'm going to go to an art event and I'm going to take part by using an adaptive paintbrush that has a specialized handle for me to do the painting activity, because we're going to talk about different artists. It might be one on impressionist painters, because that's one of my favorite areas. I love art. And so I'm going to use an adaptive paintbrush with an adaptive handle, and other people use a traditional paintbrush. Are we both still taking part in the activity? I'm getting some yeses in the chat. Awesome. And that's all the law is saying. And that's what I've been asked to just make sure that that's conveyed. That all disability means is that people use, and this is the wording you want to choose to use, okay? People with disabilities or disabled people, and we're going to talk about language later, use non-traditional methods to carry out everyday activities. So whether we use an adaptive paintbrush, whether we use voice-to-text software, whether we use a wheelchair versus walking, whether we use different types of equipment to carry out the functions of a job or the functions of an activity that you're offering. All disability means is that we use non-traditional methods to carry out everyday activities. Woohoo! All right, I'm ready. Take it away, Carrie. I know the presentation. We did give a hyperlink if you want to learn more. And we were Amanda, I'm going to share with you all the materials at the end, and you can send it to everybody who registered. All right, are you ready? Next slide, my friend Carrie.
There we go.
Carrie, what are some other examples of daily living activities that might use non-traditional methods of accommodation? That accommodation is the legal word, reasonable accommodation, and the plain language, everyday word you would use is supports.
Sure. So we have vision, movement, thinking, remembering, learning, communicating, hearing, mental health, and social relationships.
Carrie, could you give an example of an area of mental health where somebody may use an accommodation?
So thinking more of, especially for me with my psychiatric disability, for me, it is helping someone who is externally helping me recognize some of my moods, and then helping me to navigate my coping skills. So if I'm having a trying to think of the best way to say it. If I'm getting into a mood and it's not the time or the place for me to have that mood or to feel those feelings, and I need to wait until later. Like if I'm at work, I need to be working. I can wait until later to think about something if it's not work related. Then it's someone outside going, okay, I noticed that you are showing me these symptoms or signs. We've talked about this. What you've wanted to put in place is that I remind you of your coping skills. Also, the biggest one really for mental health is medication.
Sometimes people need that time where they may have to take their medicine during the day. Some people need to take food or stay hydrated to go along with that medication. So maybe they'll have be allotted an accommodation of 10 or 15 minutes to take that medication or to take that food or to have water at their desk and stay hydrated. For other people, it can even range into social relationships. For people, I'm giving an example of a disability. People with autism, social cueing, and other developmental intellectual disabilities. Social cueing can be an example of a daily living activity where they may need an accommodation. For example, if I tell a joke, I tell them it's a joke. I might be using sarcasm and they may not be able to pick up on that sarcasm. So I explain as an accommodation, I'm sharing a joke. I want you to know it's a joke. And that helps them to make the connected with the rest of the group. All right, and we put a hyperlink if you have other questions and want to learn more about examples of daily living activities and how that connects with accommodations. All right, ready? Let's go to the next slide. So we have specific types of disabilities, and we have a collage here of people with visible and invisible disabilities that fall into these disability categories. I don't say who has what disability because that's up to an individual on whether they want to disclose their disability. I disclose mine because I'm very comfortable with that. So we have cognitive disabilities, and cognitive disabilities range from head injuries, brain injuries, can be things like Parkinson's disease, Alzheimer's. They affect the brain. Physical and mobility disabilities, which is one of my categories of disability. I use a power wheelchair. I have a service animal, some of my accommodations, but physical and mobility disabilities usually mean that an individual will use a mobility device. They may use crutches, canes, manual wheelchairs, electric wheelchairs, scooters, things like that to get around. Some examples can be multiple sclerosis would be an example of a physical or mobility disability. There's tons. We'd be here all day if I told us all of them. Speech and communication disabilities are disabilities that impact someone's use of speech and sometimes the way they communicate. And so some of those could be aphasia. Some people with hearing disabilities have communication disabilities. Some people with what we would call cerebral palsy, which is a developmental disabilities, have speech disabilities as well. Some people may use sign language. Some people may use what we call an augmentative communication device. It looks like a laptop. They hit a button on it. It will speak for them, kind of in a voice like Siri. Some people use apps on a tablet phone as well that allow them to do the same thing. Then we have learning disabilities, and all that means is that people learn in non-traditional ways. These can be dyslexia, dyscalculia, dysgraphia. People may see words, letters, numbers in reverse order. People with psychiatric disabilities, and psychiatric disabilities have the largest stigma attached to them. Psychiatric disabilities have a wide range of disabilities too. It can be mood disorders, anxiety disorders, what people refer to as major depressive disorder or depression. It can be things like bipolar disorder, schizophrenia. And unfortunately, there's so much stigma attached to it, but most of us know someone with a psychiatric disability that lives an everyday life, that goes to work, has families, has a home, all of that stuff. So really, all of us need to work together as a community and society to eradicate some of that stigma. Hearing disabilities range in two categories. You have people who are what we call hard of hearing, or you have people that are completely deaf. People who are hard of hearing tend to use hearing aids or cochlear implants, and what they've asked me to share with you all, it amplifies sound. It does not replicate the hearing that people with everyday hearing have. Visual disabilities range in three categories. We have people who are low vision. That means they usually like things enlarged or magnified. We have people who are what's called legally blind. That means they can see light or in shadows. And then you have people who are completely blind, who can see nothing. Intellectual and developmental disabilities are the second disability with the largest stigma attached to them. Intellectual and developmental disabilities just mean that people with these disabilities filter and process information in non-traditional ways. I have a developmental disability. A lot of businesses in our country are run by people with intellectual and developmental disabilities, run Fortune 500 companies. And so it's had a lot of stigma, and people, the old way of thinking was that someone's IQ determined what they were capable of. And that's not the way intellectual and developmental disabilities are viewed today. So just sharing that with everybody. Health disabilities, things like COVID-19, disabilities that impact someone's health, and they may need accommodations for that. Temporary disabilities may be if an individual has a surgery, they could break their arm or another appendage, and they need accommodations or supports for a temporary time until they heal. Does anybody have any questions about that? That is a lot, I know, to intake. Does anybody have any questions about disabilities or categories of disability?
Dori, I just want to say one thing, because some people are born with disabilities, and then some people end up with a disability, later on in life. And, when you're talking about people that are hard of hearing and wearing hearing aids, like it, I've been in the field for a long time, and it just didn't even dawn on me because, my mom is gone now, but both my parents used hearing aids in their 50s, and they're, my dad's in his 80s now. And it's just something I never thought about being an actual disability, you know what I mean? But it really is, because, so it's sometimes those, I don't really have a question. I just wanted to say it's sometimes those things that we don't always think about, you know what I mean, that are altering, how we're able to live our day-to-day lives. I've just always known them to use hearing aids. That's all I've ever known. But I'm like, yeah, that's definitely a disability if you think about it.
Thanks.
Mm-hmm.
Anyone else? We want to leave you with a thought on this slide. It's very important you're using the correct category of disability because it correlates with the accommodations people use to access services and programs. I'm going to give y'all an example. We got a call a couple of weeks ago from a community entity, and they said, I have someone who's mental. What accommodation do I provide? What disability do you think they were referring to when they used the word mental? This is a safe space. No one feel uncomfortable. I want to see what you all would think if somebody came to you and used similar language. It's important that we're aware.
My first thought was bipolar or schizophrenia.
And we got intellectual disability, adult psychiatric disability. They were actually referring to learning disability, my friends. So really being aware that using the right category when we're talking about disability, when we're talking with customers, partners, community funders, because it does make a difference in how the accommodations, what they are and how they're delivered. So I just want to, because I've been doing this a long time, I said, let's delve a little bit deeper. And first I asked if the consumer had given consent to share information. And then the second thing I said was, tell me a little bit more about it. And then they described learning disability, and that's what they meant. So it's important to use the right category when we're talking about it, because it does directly correlate with accommodations and supports. Next slide. So according to the Americans with Disabilities Act, it doesn't matter the size or the income of an art location, museum, venue. You still have legal obligations to provide and maintain accessibility for visitors and patrons with disabilities. Private operated museums are covered as public accommodations under Title III of the ADA, Museums operated by state or local governments are covered by the ADA's Title II, and museums and venues that receive any federal funding, whether they are covered by Title II or Title III, are also covered by the federal law, the Rehabilitation Act of 1973, Section 504. And I gave you some more information on that. So if you want to delve deeper into that, I encourage you to do so. Next slide. So, Carrie, tell us a little bit more about how disability impacts us, not only in this country, but here directly in South Carolina.
Sure. So per the Centers for Disease Control, the CDC, 61 million Americans have a disability. So that roughly estimates to 1 in 4 Americans. And that means, unfortunately, South Carolina is, of course, always wants to be higher than the national average. Not unfortunately, but South Carolina wants to be higher than the national average. So 1 in 3 South Carolinians has a disability, which leads us to disability being the largest minority group in the United States, but oftentimes we are the least represented.
So when we talk about DEI, where diversity, equity, and inclusion, disability is the largest minority group in that realm. And they're looking at right now, it's going to be changed to diversity, equity, inclusion, and accessibility, because disability is the largest representation of minorities, because we intersect with all other cultural backgrounds. Disability intersects with Black, Indigenous people of color. It intersects with the LGBTQIA plus community. It intersects with the aging community. It intersects with the people of different socioeconomic statuses. So it's really important as you're delving forward in your programs and you're looking at how can you expand your programs, and when you do things around DEI and DEIA, that you're doing projects and representation of the disability community, because we are the largest minority group. Next slide. We went into more detail just so you all would have the slide, because we knew people would be interested to see how it all breaks down. So we did do a slide for you so that you could have all of that information and link to it. And we'll go to the next slide. So I'm going to ask y'all a couple of questions. I want you to think about what we as a culture and a society have been taught about disability from childhood and beyond. And I'm going to share briefly. As a person with a disability, when I first started going to school in the early 1970s, we didn't have any laws that allowed people with disabilities to go to school with people without. And I would ask my mom why I couldn't go to school with my best friend who lived next door. And I had to go to what we called back then, only using the word for what it was called for historical context, was a special school, because it was only for people with disabilities. And so I learned very young that disability meant separate, not included. Can you all share with us what might be some of your memories of the first time you became aware of disability, or the first time you might have had any exposure to people with disabilities? Anybody have something you might want to share? If not, I'll ask some prompting questions.
I would say when I was very young, I have a lot of developmental disabilities, and I have a Tourette syndrome and ADHD and things like that. And it was very, very hard in school. And the first time I realized that I was treated differently for my disability was being pulled out of class to be into a separate classroom with other kids, because I wasn't fast enough, what they said, to learn.
Thank you, Tara, for sharing that.
Yeah.
How many of you, and I'm just you could just say yes or raise your digital hand or your physical hand if you're on camera. How many of you remember when you went to school that people with disabilities went to a separate classroom or a separate bus? They were not in the same classrooms. They were not in the same buses. They were not in the same even community activities. So we're taught from a very young age that people with disabilities are separate, different, and that sometimes unconsciously can stick with us without us even realizing it. Both the disability community and people without disabilities, that can stick with you. So I'm going to ask you all, what do you think we as a society are unconsciously taught about disability from childhood? Are we taught to feel sorry for people with disabilities? That would be sympathy. Or to have empathy? Which one do you think is the primary one that society is taught? I see a lot of sympathies. Excellent, y'all. Some of us may have different lived experience. If you may have had siblings or children with disabilities or somebody in your community that you were friends with or who was a good role model. I'm not saying everybody fits into that, but statistics show nationally that people are taught to feel sorry for people with disabilities from a young age, and that permeates into what we do as we get older without us even realizing it, unless we may have been the disabled person, and even then we can have internalized ableism and sympathy, or you have an experience with someone close to you that might have positively impacted that from sympathy to empathy. All right, next slide. I'm going to ask you all, because you work in this field every day. Thank you, Karen said for her it was sympathy, but for people in their 20s, early 30s, it could be different. Karen's right. As time has evolved, we have seen more inclusion and more interaction, but unfortunately, Karen, statistics are still showing nationally that there's more a wave of sympathy than empathy. And I think that's because we still have a little ways to go. I like Ed said, I think too many organizations are also suggesting sympathy. I was on the board of an association. I'm trying to get there, Ed. It's shut on my screen. Let me see. Of an association for the blind, and their employer, MESO, is to give our consumers who are blind a chance. And I used to say there's a solid business reason to hire them. Be empathetic. Love hearing that, Ed. Woohoo! That's exactly right. There is. But the reason I wanted to tie it all together for y'all. So we just talked about that we can be, as a society, taught sympathy for people with disabilities. And sometimes that sympathy can lead to barriers. And I'm going to tell you more often than not, it does. What might be, so I want y'all to think about what might be some barriers for individuals with disabilities in being able to access services, programs, or activities involving the arts. Y'all can put it in the chat. You can unmute yourselves. We love a good interactive conversation. But I'd just like to know what y'all think are some barriers. You can even think about the disability categories. Ebony Deloach said transportation can be a barrier to being able to get to these venues and programs. Inaccessible buildings. Thanks, Amanda. Funding to make things accessible. People with disabilities maybe not feeling welcome. Loving these answers, y'all. Not loving that they exist, but loving the participation. Programs being, maybe we only have in print, physical print, instead of alternative format. Thanks, Laurel. Seating in the theater or play being too loud. Sizes of classrooms, access to facilities, no interpreters at performances. Awesome answers, y'all. Not awesome they exist, but thank you for the participation. These are wonderful. Job seekers at some of these art places not being given the opportunities for employment. Somebody said, I think attitude changes quicker with children of today. She said she feels behind. You know, it's never too late, my friends. We can all learn, grow, and evolve. I know I do every day from our community and what I learn from other people. So that's a great part of today. Next slide. So, Carrie, we're going to talk about the barriers that have been identified by the disability community, as well as some studies done by the CDC of the disability community, or what are barriers to community access and entities. So let's go to the next slide. The first one is attitudinal. That's the idea that some of you already mentioned in your answers. The idea that people with disabilities are less than, which unfortunately then can lead to discrimination. Communication barriers are anything that prevents individuals from receiving and understanding information and ideas that are being shared. So some of you said that if we don't have a sign language interpreter, if we don't have alternative formats for our brochures, for our art, for our actually participating in the program and the directions for how to do so, that can be a barrier. Physical and architectural barriers are any structural obstacle in a person's environment that interfere with mobility, moving around, or access. Y'all name some of that. That might be no elevators, stairs, lack of curb cuts, not wide enough doorways, inaccessible bathrooms. Those are just some examples. Policy barriers are we either don't have a policy around accessibility and providing accommodations written down in our policies as an organization, or we're not enforcing those laws, procedures, or regulations that require programs and activities to be accessible to people with disabilities. Next slide, my friend. Social barriers are when we have disparities in employment, education, safety, etc. What do I mean by that? Separate is not equal. Having a separate program only for people with disabilities to participate is not equitable. The law says we have to provide accommodations to our programs to make them accessible and inclusive. And it's a great thing because that shows our communities that we are all wanted, we all are invited, and we all have a seat at that table. One of our folks, Ebony, said transportation. That's either there's not accessible transportation in the area and they can't get there. That's in a lot of our rural communities, or the transportation we do have is limited. Programmatic barriers are when we don't provide people the accommodations they request or need to participate. It could be a PCA, which is a personal care attendant, or not using plain language for people with developmental, intellectual, cognitive disabilities to understand the information. Digital accessibility, that's when our electronic website, our electronic content, like our websites, our social media, or any digital documents that you have are not accessible and screen reader friendly. We have videos on our social media and we don't put captioning in there for the deaf community, and we don't use plain language to explain what we're conveying in our videos and on our websites and in our digital documents so that all people can understand it. The average American and South Carolinian reads at a 6th grade level. That's already been determined. And consequently, plain language doesn't just assist the disability community, it assists the greater community at large in understanding what you're trying to convey to them. Next slide. So those barriers lead to how we can work on accessibility to make our art venues, our art programs, and our facilities and grounds accessible. And what the Americans with Disabilities Act says is that all of these things have to provide accessible parking, have to have accessible programs, accessible entrances, accessible routes throughout the exhibits, accessible restrooms. And I know y'all might laugh at the last one, but if you have any telephone station, even though people may use cell phones these days, you are still required to have an accessible telephone station with a TTY and other accessibility options somebody may need to utilize it or to get information from that call-in number about your museum or your program, etc. All right, next slide. Some other things that are required under the law would be that all of your staff and volunteers need to know about how to use, if you use telephone relay, which is also called 711. It is a national service that anyone can access to communicate with an individual with a hearing disability, because they will communicate using sign language through a video phone, a computer, a tablet, a cell phone, and they will sign what you're sharing to them. And then the relay operator will tell you what they are signing to that person. The person is signing to the operator so that you know and can communicate. This service is offered for people who are deaf, hard of hearing, or have speech disabilities. And all of us should be prepared to use it. Is what the law says in the correct way. And if y'all need training on that, Able offers that as well. We also encourage everyone, as does the ADA and the Rehab Act of 1973, that all alternative formats for printed brochures and program materials should be and include Braille and large print. You have to keep them current, in stock, and easy to find by the public. So you want them in very public facing locations so that anyone with a disability could use it at any time. All right, next slide. We'll go to the next one, programmatic barriers. And on the screen, I have a person with a visual disability using their white cane. They're using the metal strips on the floor to guide their walking. All right, next slide. If I were to go to your programs now, and this is a safe space, my friends, that's why we're all here, to educate, learn, and share ideas and work together beyond today. If I were to go to your programs, and based on the barriers that I just talked about, the law asked each of our entities under Title II and Title III of the ADA, as well as the Rehabilitation Act of 1973, to ensure any program we have, any service we offer, and any activities that we showcase, and the facilities that we do them in, no matter whether they're owned by us or rented, they have to be accessible to people with disabilities, okay? And we can't use, for example, I can't say, I'm using you, David, because you and I are good buddies, my friend. If I go to David's art museum, David can't say, well, you use a wheelchair, so you can't come in. Okay, that would be what we call eligibility criteria that screens out someone with a particular disability. So we can't decide who with disabilities can come and who with disabilities can't. Okay, everybody has to be given opportunity. So I'm going to ask y'all a question. You ready? It correlates with our Title II and Title III of the ADA. If we showed up at your art venue, your art program, anything of any medium, can a disabled individual, that means every single category Dori and Carrie showcased in the beginning of the presentation, can a disabled individual access all of your services and programs currently? Every single type of disability. Getting a lot of no's. I love this group. I love y'all are doing what I call dignity of risk. That means you're stepping up, you're sharing, and that's how we work together, and that's how we collaborate and we work with you to help you do that. So that's a great thing. Thank y'all for embracing what I call uncomfortable sharing. So thank you. I like this group, David and Amanda. Maybe they could go on the road with me. What do you think? Woohoo! All right. Next
I'm
slide.
pretty sure we can make that happen, Dori.
All right. Are you ready, Carrie?
Yep.
All right. We gave you all some things to consider, and you will get a PDF of this, okay? Some basic things that we all can think about and do. Number one, are your materials available in alternative format? That would be Braille, large print, audio recording, plain language. That means all of them, okay? Do your staff and volunteers know about auxiliary aids and services? That could be assistive listening devices, audio description tours, closed captioning controls in exhibitions, and they have to remain operable except for maintenance or repairs, what the law says. So you can't just take an exhibit out because you don't like it if it's offering accessibility to people in an alternative way. Do you have practices in place to de-escalate situations if someone becomes frustrated? That has nothing to do with a particular type of disability. That has everything to do if Dori took 3 buses to get to the art museum in the middle of the rain yesterday and storm. I show up and somebody over the phone had told me they had an alternative format for the exhibit, and I get there after I went through all of that to get there, and I get very upset because I came all that way expecting it to be accessible and expecting it to be inclusive based on a conversation I had with somebody over the phone. Did everybody see that? It's basic customer service. It had nothing to do with particular disabilities. It has to do with just looking at, imagine if you took 3 buses to get somewhere in the pouring rain, you get there and you find out, no, indeed, it's not accessible. And this is somebody who called on the phone to find out before they made the journey. So it's really important because that could happen accidentally. We've been down that road, Able, back in the day when we first started. Things happen, okay? And that's okay. But just be thinking about now, what would we do in that situation? Have we informed all of our volunteers and staff where you find the accessible formats for things? Do they know how to handle if someone calls or shows up and needs particular accommodations? It's really to get you to just examine that part of it. And lastly, do you have a policy about service animals? Because Dori loves to go to the art things in town, and I bring my service animal. So you want to make sure that everybody's on board with the policy, everybody understands what it is, and that you have one in place. All right, next slide. This comes from the law, which is why I share it. If touchable objects, and it's literally, I am not an attorney, so I'm going to phrase it this way. The ADA says, if touchable objects are used to provide access to the content of exhibitions and programs for people with disabilities, care should be taken to maintain those objects' condition. If an object is removed from the tactile collection for any reason, it should be replaced with one of equal quality that conveys tactually the same information about the exhibit or the program exhibit's themes. Okay, next slide. We also, I know David and Mary and Amanda are working with y'all on this, but just a reminder, some things to think about. Can someone who uses a screen reader fully utilize your website? These would be people with visual, cognitive, learning, and developmental disabilities. I use a screen reader not to have it read to me, but to absorb the information on that website, as do people with other disabilities. So being aware it's not just for visual disabilities. Do you know how to communicate with someone with a hearing disability through an interpreter or video relay service? And we always just share, be prepared to make individual accommodations and think outside the box for solutions that allow individuals to access your programs. And my BFF David said in the beginning of this, we are here to be your partner. After today, beyond, even when this grant ends, we are here for you. So don't ever feel like you can't send an email, pick up the phone, have Amanda reach out to us, have David tell me you need something. We are here for you, and we want to make sure you know that. We live it every day. We're going to give you the most effective, low cost idea. Okay. We live with disabilities. We're not reaching to spend millions of dollars. Okay. We're going to say, hey, have you thought about this? Hey, have you thought about this? One of the art exhibits in town wanted to set up a paint station for one of their folks they knew came on a regular basis. They called me and asked me what they can do. And I said, well, I'd love to help you. Have we talked to the individual yet? And they hadn't. They were so well intentioned and so excited they hadn't reached out to them yet. So I said, let's do that first. So they reached out to them first. And they said, we're really excited to have you participate. We want to do this, 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 and this. And it was so wonderful. They wanted to do all this. And then the patron just said, oh, all I need you to do is just let me bring my accessible paintbrush and my accessible art easel I have. So really, it's just, let's ask the individual before you all have to do all this effort. They may be able to tell you. And then if they say, I don't know what would be best, then hello, Able, and we will help you. But sometimes we like to just reiterate, if it's a regular customer and patron, they probably have some thoughts that they've already thought about. So thanks, y'all. Next slide.
And I'd just like to throw in there, Dori, that reaching out to me especially, I think the ADA is the coolest thing I've ever encountered. So if you want to reach out to me, I would love to chat with you about it, because I would love to what they call nerd out and talk to you more about it. So please reach out.
She does like it. She enjoys the nerding out. I do too. I love accommodations. It's probably my favorite thing in the ADA. All right, next slide. The law also says, as a community entity who is providing any kind of program, service, activity, that you have to provide effective communication. That means that whether you're a job applicant, a participant, or a member of the general public, you have to have communication access that is as effective as that provided to people without disabilities. One of the things that people don't always know is that the community entity has to give primary consideration to the communication preference of the person with a disability. That means if Dori were to be a person with a hearing disability, I'm not, but if I were, and I were to say to y'all, I need sign language in order to participate in this program, you have to take consideration of what that individual uses. I'm going to be honest with you. Sometimes I go to some of the programs, and one of the things I do utilize is plain language. So I will politely ask the person at the art venue to just, could you break that down a little bit more for me so I can understand exactly what you're sharing? And sometimes people will do that. That's another example of effective communication. Some people will ask for Braille in large print so that they can have the information. And those are also great examples. Next slide, my friends. There are auxiliary aids for communication for people with hearing disabilities. Those include qualified interpreters, captioning of emergency alerts that you may have in the museum if like yesterday happened and we need to get people out, things like that. Transcription services and video remote interpreting. That's 711 called VRI. Speech disabilities. People use speech synthesizers, augmentative communication devices, computers, tablets, phones, apps, or communication boards. A communication board looks like a poster board, and it may have visuals that indicate, they point to ask you what they need. Some people have it just laminated on paper. Some people have what Dori would call, I have a person who uses communication cards, and everywhere they go in our communities, they pull the cards out and they'll hold them up and show it to the person they're communicating with. So it can be in a variety of formats. And we gave you some more information at the bottom, but Visual disabilities can be large print, braille, screen reader, accessible web and mobile applications, readers and apps with directions like Google Maps. People with visual disabilities may use that to walk and navigate. All right, next. Architectural barriers, and I have on the screen a picture of stairs. All right, next slide. Some things to consider with that: do you have ADA compliant accessible parking spaces that are clearly marked? Sometimes Dave and Mary will go out and do an assessment, and people are like surprised by that because they're like, well, it has the symbol, right? But we don't know. Somebody could have just painted that symbol on or taped it on the door, and it doesn't mean it's ADA compliant. And they may not have done that purposely. It could have been done 20 years ago, friends, before, things were outlined in the ADA. Does your building have functioning automatic doors? Is the pathway free of plants and other barriers? Is the ticket or entrance station low enough for someone in a wheelchair or other mobility device to access? I want to give you all a suggestion for number 2. If you don't have automatic doors and you're waiting to get those, or it's going to take a little while, then make just a laminated sign or in a page protector that says, if you need assistance getting into the building, please call so-and-so, whatever their name might be, whoever you designate, at this number. And that works because it allows for accessibility in an equitable way, so that if somebody has to get in, they can get in touch with somebody. Make sure you make that designated person somebody who's at their phone on a regular basis. Next slide. Some more things to consider are public spaces in an area. Are they accessible to everyone? Are the signs indicating accessible entrances easily viewed? Sometimes we have to go in a different entrance around the side or back, and that needs to be indicated somewhere, like on a front door or somewhere, where to go. Do the signs have raised lettering and braille? Do fire alarms utilize flashing lights for individuals who are deaf? And are bathroom stalls areas large enough for wheelchair users to maneuver easily? Next slide. All right. Attitudinal barriers, and it's a picture. It is me, but it's me demonstrating attitudinal barrier for folks. So let's go to the next slide. Carrie, would you like to ask this question?
Absolutely. So our question is, are you treating individuals with disabilities like us as equals and including them in all parts of community arts activities?
I want you all to not, the you is not you. The you is the society proverbial you. Do you all think people with every kind of disability are getting the same equitable access to participate in all facets of community arts and activities? What do y'all say? And David, if I miss anything, let me know. I'm seeing a lot of no's in the chat. And I appreciate that. I really love when we all come together, because I know sometimes can feel uncomfortable, but that's how we make change. When we step into the uncomfortable and we all work together, it only makes our programs and our communities better for everyone else. All right. Thank y'all. Next slide, Carrie. Carrie, I'm going to let you talk a little bit about ableism.
Absolutely. So ableism, we like to point out, is not a term coined by Able South Carolina. It predates us because people have asked. So ableism is discrimination and social prejudice against people with disabilities and people who are perceived to be disabled, another part of the ADA that I like to nerd out about. When you presume a person is less than because of their disability. And some examples of ableist beliefs are, we should feel sorry for people with disabilities. People with disabilities have a poor quality of life. Individuals without visible disabilities are faking it and should try harder. Preferring to hang out with individuals without disabilities rather than with disabled people. People with disabilities shouldn't have children, and people with disabilities should not be able to make decisions for themselves. So here are some strategies for avoiding ableism. Our big one, of course, because we are consumer controlled, we like to allow people with disabilities to make decisions about their lives, especially for us at Able. People with disabilities are able to opt in or opt out of all of our services, and we like to lead by example in doing that. We should encourage individuals to develop and use their independent living skills. We should assist people with disabilities in being a part of their community and customer base. Have high expectations for people with disabilities and let them make mistakes, the dignity of risk that Dori was talking about earlier. We should give individuals the opportunity to try. Don't assume they can't do something or that they need your help. And then pay attention to the environment, the accessibility, the equity, and the inclusion.
In a nutshell, we really just want to remind people to use an individualized approach. That's so important. People with disabilities, we're not all the same. Even if we have the same disabilities, there's no one size fits all. Everyone communicates in their own way, whether they use physical voice or other methods of communications. And we all, at the end of the day, don't have the same likes, dislikes, talents, families, talents, but we do have the ability to learn, and we do have the desire to feel as though we're included in our community's activities. Next slide. And we also value privacy and independence. That's important too, meaning we don't want to disclose our disabilities unless it's relevant to do so for accommodations or a need that we would want. And let us be the drivers of what supports people with disabilities need, meaning let that individual tell you what you need and how you can best help them. Next slide.
There we go.
Carrie's going to share with you what people with disabilities shared with us. How can community entities show them respect when they're visiting their facilities, their programs, and their activities?
Absolutely. So people with disabilities have shared with us and asked that we share with you that they would like for you to show respect to the employees and consumers that you're working for and with. And respect can look like asking for permission before you help or touch them. That includes people who are wheelchair users, asking before you touch their wheelchairs, asking before you help them along, asking a person who is blind if they would like to take your arm and help them navigate the world. Avoid talking to others about the individual's private information. Encourage the person to speak up for their reasonable accommodations, modifications, and needs, and then letting the person make their own decisions, even if you disagree with them.
You may not like the accommodation they choose or the way they want to do things, but that's okay. It's their choice and right to do so, and that's okay. Sometimes we all don't agree with each other. That's a part of life. Next slide. Inspiration porn is when people with disabilities, it's not pornography, it's like pornography in that it objectifies people with disabilities. It puts them in situations where people say things like, you are inspirational, you are so brave because you came to the museum. No, people with disabilities just want to be equal and have equitable opportunity and do the same things everybody else does. It doesn't make anyone brave or courageous for doing those things. And we're going to show a slide. Memes like using a person with a disability and then saying your excuse is invalid, that objectifies someone. And things like yes proms, where non-disabled people take a disabled person to the prom and suddenly they're this big hero and they're all over television. If it was two disabled people, we wouldn't see it. If it was two non-disabled people, we wouldn't see it. But when a person with a disability is put with a person without a disability for doing a traditional, typical thing, sometimes people add inspiration porn to it. And then it makes it more difficult for people with disabilities like Carrie, Dori, Tara, who self-disclosed earlier, and Ebony, who self-disclosed earlier. It makes it much harder because it's another barrier of attitudinal barriers that we have to get through just to be treated equitably like everyone else. All right, next slide. Language and identity. Next slide, Carrie. You want to just give an overview? What words should we definitely stay away from, Carrie?
Yes, these are a hard no. So we're staying away from cripple, suffering from. I do not suffer from my disabilities. They are a part of my identity. Dori is not wheelchair bound. She gets out of her wheelchair. She goes and does other things. She's a wheelchair user. Handicapped is another one, which was incredibly popular, but it's a very outdated term now. Special or special needs, that was terms that were coined by the Board of Education. The disability community has asked for about 10 years now that they stop using those terms. And that's just another example of the voices of the disability community being minimalized and not listened to. The R word being a lot of people still don't know what we're talking about when we say that, so I will say it, and that is retarded. And then also we're staying away from patronizing language, like referring to all people with disabilities as your friend or buddy. It's not those words in particular, it's the way that people use them. It's very high-pitched. Dori, I love to call on Dori on this part because
She
she
likes
does it a
me
whole
to
lot
do
better than
it
I
because
do.
she thinks I do it in a way that gets people's attention. It's like this, hey, David, my buddy David, and my friend, and it's this very childlike amplified tone. And it's not the words themselves. Like, I consider all of you my new friends because we're going to work together to make art accessible and inclusive. But the reality is, when you amplify it and make it childlike, that's what you want to stay away from. And assuming, like, offering that childlike connotation to people with disabilities.
That's how we talk to our dogs, Dori.
Yes, exactly. It is. Next one, Care.
All right, so then we're going to talk about, there's two different ways that people with disabilities can be referred to or like to be referred to. First is person first language. This describes the person, not the disability. And it reminds us that disability is just one aspect of the person. So we're putting person first. So person with an intellectual disability, person with a physical disability, wheelchair user, accessible parking space, person without a disability. And then our other option is identity first language, which many people with disabilities also embrace identity first language, which positions the disability as an identity category. This language is known as identity first because the identifying word comes first in the sentence, and it highlights the person's embrace of their identity because we are proud of who we are. So our examples are disabled and autistic are two of our examples.
And you're all going to get a handout on it. I'm going to go over briefly some best practices, some of which we've covered, but I wanted you to have them that are recognized and recommended for art programs and venues and facilities. Next slide. So, number one, develop a policy for how you're going to provide goods and services to individuals with disabilities in accordance with the requirements of Title III of the ADA. So you want to make sure that your services are accessible and how you're providing them are accessible using accommodations. Creating training materials on providing access to patrons who have disabilities and distribute them to all employees prior to the event. It could even be as easily, my friends, as doing another one of these trainings for your staff and your volunteers at your venue and your facility and your program and inviting Able to partner with you and doing the training. Offer reasonable accommodations and program modifications to participants. Any material should include information about the requirements of the ADA, policies concerning providing access to programs, activities, and services at the museum, the location of accessible toilet facilities and telephones, and the procedures for contacting professional staff if questions and problems arise on accessibility. So this is where I'm talking about designating a person who is going to take all of those questions, individuals with disabilities who want to take part in your programs at your facilities and venues. They recommend you have a point of contact. All right, next slide. Provide information within flyers and brochures regarding the accommodations available to people with disabilities at an art event. Prominently display the written information and distribute it at all entrance and ticket stations. Shops must allow merchandise to spill, should not rather, allow merchandise to spill into aisles and narrow the width of the accessible route. Sales and ticket counters that have been lowered to provide access must be clear and unobstructed. And staff should know how to assist people who need help reaching or seeing merchandise. If they have a visual disability, they're not going to know what's in the store. So somebody has to be prepared to give a visual description to them. Next slide. Go to the next one. Reasonable accommodations and program. We gave you some overall. We knew we would not be able to do this everything we do, but we wanted y'all to have some examples of what some of those reasonable accommodations can look like. I'm just going to give you a couple. It could be clips and Velcro to hold canvas or other structures for someone to do art, large buttons to control paintbrushes and electronic art material, computerized drawing or painting programs, allowing people to use adaptive equipment, either they bring or you have, like a joystick, a trackball, or a head or eye controlled input device. You can go to the next slide, Carrie. I just wanted y'all to see, you're getting a copy of this, what those examples look like. That first one is they used a binder and adapted it with just clips you can get at an Office Depot to hold something down for people to do art. The next one is a large button that you can use on different computers and different art equipment. The third one is actually a computerized art program that allows people who don't have the use of their physical hands to do art. The ones at the bottom are adaptive handles that people have made just out of plastic and different things. They don't cost much. The last one is a dish brush, so people can do painting who can't utilize a standard paintbrush. It's pretty neat stuff. Next slide. And I just showed y'all these are just some other art programs that have been done. I did one of these with the State Museum last summer for Disability Pride Day. They did an art thing and it allowed people in wheelchairs to do exactly what they're doing on these pictures, to be able to paint using their wheelchairs. It was pretty awesome. You can do it with chalk, paint. The second picture is one of my favorites. An art museum got an engineer to help them design plastic handles to charcoal so the kids could do charcoal painting, charcoal drawings, and be able to reach it and be able to adapt it. It was pretty fascinating. I loved it, all the things I've learned. And you're going to get these. You can keep going, Carrie. I just wanted them to see some of what I put in. I want to end this presentation because at the end here is just some resources and great things. Thank you, Nina. Nina added in for y'all to know that there are people with autism who want to be called autistic or autistic person. Thanks for sharing that. All right. We want to end this presentation with some ideas from you all about how you could improve accessibility for art and community art programs for people with disabilities. Based on some of what you heard today, what are some easy things that you all think you could do to make art and art programs more accessible for people with disabilities? It doesn't have to be complicated. It could be providing accommodations or having a policy for. What are some other ideas that y'all think you could do? Have a program with a larger font. Go, Andrea. Woohoo! Or Andrea. I'm not sure how you pronounce it, but woohoo! Great answer. Who can think of something else? Use plain language. Yay, Amanda. Who else can think of something that you could do? It doesn't have to be complicated. Automatic entrance doors. Great answer, Karen. Anybody else? Think of something you think you or your program. And I don't mean just you. When we say you, we mean everybody that works with you at your place of art. Make sure your website's accessible. Awesome, Laurel. Host a professional development on accessibility for staff at your agency. Woohoo! And your volunteers. I love to include volunteers because at your art program, I've met some of the most phenomenal people that volunteer their time. One of our staff volunteers his time at the local art museum, so it's awesome. I'm going to unshare, David, or if Carrie could. I'd like to give everybody a few minutes to ask questions, and I like to be able to see people. And sometimes when we're in that format, we can't see people. And if anybody has to go, we are going to send you a sheet on the updated language with the historical context. Amanda will get it to you. I'm going to send you easy strategies to make things accessible for patrons or anyone with a disability. They could be a community partner or funder, and a PDF of the PowerPoint. But I want to give you all a chance to ask us any questions that you might have, or thoughts or comments, anything you want to share.
In thinking about disability and as you pointed out, the language in the disability community is changing rapidly, just like in the LGBTQIA community. Language that was acceptable even 10 years ago is not acceptable today. But with all that change, this made me think, it is ESL disability in some way, as well as poverty. I've often thought about poverty as a barrier to participation. I mean, it's not
and
really.
Most of the disability community, Karen, does live at the poverty line as a marginalized community, and a community that is the largest minority. Some language alone would not make someone be considered as having a disability, but they could also be a person with a disability.
Language, a barrier.
It could be a barrier. That's probably where I would put it too, Karen. And I think overall, that's why we're going to be providing you all a language sheet that is also the language is considered under the ADA, and it is audited under the ADA funding and Rehabilitation Act funding. But it gives you the historical context of some of the words, and it also, I could do a whole presentation on that, but that would take a lot of time. It's very fascinating, y'all. Where's, like Carrie gave you all the examples, special needs. Special needs is not preferred by people with disabilities nationally and internationally because it implies that our needs are more special than yours. No, everybody's needs are equitable and equal. And people with disabilities don't want to be special because we have disabilities. We want to be considered unique because we have talent, skills, and abilities. And so really looking at that. And so the disability community has been asking nationally and internationally the education community to stop using that term. And as Carrie pointed out, they've chosen just to disregard a large group of people and what they are asking for. And if that happened with other cultural groups, it wouldn't be acceptable. But it's how disabled people are viewed, that we are not capable of telling you we don't like something, or that we're childlike and what somebody else wants should override that. And so if you have questions after you get the handout, Amanda, you are welcome to provide my email, and I am happy to work, just because there's a lot on it, Karen. It's like 8 pages, and I don't think I could cover every part of it right now, but I am happy to answer anything from anybody after this too. But thank you for saying that. I appreciate what you shared. Anybody else?
I have a question.
Sure.
It's
And is it Andrea or Andrea?
it's Andrea.
Awesome.
Thank you for asking.
You're
I have a really
welcome.
hard time correcting. I'm something I have to work on. It's not related to the arts, but how would be the best way to address another organization or company, if I were to see that there's a barrier? For example, when I was planning a wedding shower, I was trying to find a restaurant that had a wheelchair accessibility for my mother-in-law, and a lot of for a party room. A lot of restaurants had wheelchair accessibility, but their party rooms did not. And that was really frustrating. And I didn't know if that was going against the ADA rules and laws, or how's the best way to go about something
You
like
would
that?
be
'Cause there's a
surprised
lot
at
of
how many
restaurants.
guidelines are in there, Andrea. So I can't give you like a flat yes or no answer. There are specific guidelines that are attached to different businesses. But I'm sure if you would like more information, David, we could probably connect her with Mary, is what I'm thinking for that.
I just absolutely, and just as Dory referenced, the ADA is a written, it just has a bare minimum, and just in terms of accessibility, we recognize that there's much more that it should do, and there are a lot of restrictions in terms of what it does allow. It does open the door in many situations, though it is not the perfect fix. We are continually seeking in terms of greater advances.
And that's because I have my coordinator certification, but then they have a guideline, Andrea, that's like a notebook, and multiply that like 10 times, because you have to look at each individual business, and it's divided by how big they are, how many people they serve. I mean, it's complex. So what I'm saying is we could look into it with Mary and our access team and see an approachable, we could look at what the restaurant is, and then steps to even maybe educate them in a way, because I know your ultimate goal is just to educate them so it's more accessible and inclusive, and all of that. But that's why I'm saying to y'all, like, I can't just say, oh, there's a flat answer, because it depends on how big, it depends on how many people you serve. It's a lot to it, but we'd be happy to help you. And if you, Amanda, want to connect Andrea with David and Mary could help with that.
Thank you.
Anytime. It's not like one of those yes or no. I wish it was. So you know how many times I have to tell people, well, no, we have to know this, and then we're going to have to look into this, and then we can do this. And yeah. Anybody else? This has been such a joy. Y'all are such a wonderful group. I've told Amanda how much I have enjoyed getting to go to the different locations, Amanda, and work with different folks so far. And we're going to be doing more of that this year. And what a pleasure it's been. Y'all are doing great work, and I commend you for wanting to to applying for the grant and then having the passion for wanting to make these changes, because that's really a step in the right direction and how amazing it is.
Like, I would just like to say, like, this I felt was like more concentrating on museums. And I found, like, except outside of major cities like New York City, smaller cities with community theaters may have what they consider like access to the theater, but that's to the front of the house. I have yet really to see a community theater that had backstage access that allowed performers with disabilities to perform and participate. Do you have any suggestions or?
So, that's a great entry point in terms of where we're coming back on February 7th, where myself and my colleague, in terms of Mary Reeves, we're going to be talking a little bit in terms of what we've learned from a lot of the arts programs over the past 6-8 months, of really some more concrete ways to make your arts programs accessible. Everything from architectural avenue, from your visitors, your guests, and also your actors and your participants. But also looking in terms of making sure your program as well is accessible. So we're going to be spending a lot more time on that on February 7th, focus only on that topic. So that's a great.
I just wanted y'all to know we divided this with Amanda into different series. So we were each assigned our different section of it. So this was my section because this is my specialty. And then other people that you're going to meet, my colleagues, David, Mary, and other people down the way who it's their specialty to do other things that we do. So, yay, woohoo! But I agree with you, Marie. Dori goes to these places, and I'm exactly in that boat because I can only sit in certain places. I may only be able to have access to certain things. And I remember I did theater in college, y'all, and luckily the theater guy was all about including everyone, because he had to build a special ramp just so I could take part because it wasn't accessible and he wanted everyone. Thank you, Alicia. So I love that you're bringing these things up because they're important, because the ADA has guidelines. Some of them are just minimal guidelines, and we can sometimes, right, David, think outside the box and step it up in a not expensive way to make it even better. And that's great. I can't tell Amanda how much I love this project. I've just had the best time. Y'all are phenomenal people. Thank you for taking a passion for all this.
And I just want to add, it's an aside, but Darian McLeod, who is an actor and an activist and founder of the NIA Company in Columbia, South Carolina, is working with a group of people, and I believe, and people with disabilities, and they are going to be the theater troupe. And I believe their first production is probably mid-year, and I believe it's going to be at the Children's Marionette Theater or the Children's Theater. Yeah.
That's awesome. I'll let David write that down. Maybe we can find out more about that.
Yes, and have it ready for February 7th.
Awesome. Thanks, Andrea. Have a good day. If nobody, I'm not wanting to keep anyone, so if you have other questions, I mean, I'm fine. I didn't want to keep anybody else who may have to get somewhere, but we always want to be open for questions. And Amanda, as I've told you in the past, if anybody has something after that, if you're like me, I go to a webinar and I might think of something a week from now, right? Because I've had time to process it more, not because of my disability, but sometimes until we have time to think about it in our everyday work. Oh yeah, what would we do here, right? So Thank you, Laurel.
Thank you so much, Dori. Your presentations are always so engaging and just such great information. So thank you for kicking off this series, and we'll look forward to continuing next month with David and Mary. So we hope that people will come back and check out the next session.
Thank you all so much. You should be receiving an email from our staff in terms of follow-up and evaluation, along with the resources that have been referenced. we wish you all just a great evening and look forward to seeing you on February 7th.
Bye, everybody. Hope to see you soon. Take care.
Yay. Awesome. Thanks, David.
That went
Thank you,
great.
interpreters. You guys are awesome.
Thank y'all so much, Beth and Heather.
We'll see you in February.